the Midwest, Milwaukee, Wisconsin. Chiropractor, kinesiologist, clinical nutritionist, clinic director of the Natural Medicine Center in Houston, Texas. 30 plus years in clinical practice. And if we can share the screen, they used to say that a picture is worth 1,000 words, but reality is now that they've done brain mapping, they can understand that a picture is worth 2 million words. So I use a lot of pictures to make points and teach and share. In my 3 decades plus of clinical practice, I have treated world champions from every major professional sport. And I've also seen the other end of the spectrum, people that were sent home to die. And some of them, thankfully, are alive decades later. So are we're stuck with that? I'm gonna share a principle and a teaching tool that is applicable to essentially all the tissues of our body. So nothing going there yet. Mm-hmm. Well, while we're getting the technical right, any special requests? Any questions about any topic of interest from anybody? Heart rate variability?
I know, but
Yeah.
I just thought
Yeah. Sure. Fair enough. There we go. There we go. All right. So when we start talking about stress, I actually think it's been the greatest killer on planet Earth since the beginning of humanity. And believe it or not, even fossil records share that. When they find skulls that have evidence of the teeth being ground, which is something called bruxism, they estimate that whoever was in that skull died about 15.4 years earlier than people that didn't grind their teeth. So if you look at the picture on the bottom right of that foot was scheduled to be amputated 2 days from the day that first picture was taken. But look at it 2 weeks later, and then look at it 17 months later. And what's so fascinating about that is the teaching point is whenever there's a problem in any tissue or organ system in the body, there are 3 distinct zones of cells. There are cells that are dead. There's nothing we can do about it. Whoop. My beautiful friends. Actually, our wonderful friend is asking if you could, well, either that or just move the conversation just a little further away. But, all right. Thank you for that. All right. So understand that medicine will say, well, there's a point of no return. I was talking to a patient this morning and she said, well, yeah, they removed my gallbladder. Well, I've had people that go in, they'll have a gallbladder test and they'll say, well, my gallbladder is only functioning at 30%. So they want to remove it. And I'd say, well, at what rate will it be functioning then? It would seem that 30% would be better than 0%. But keep in mind, if the tissue's not dead, and that's the point I want to make here. Whenever there's a problem with any tissue or system in the body, there are 3 distinct zones of cells. There are cells that are dead. There's nothing you can do about that. There are cells that are fine. There's nothing you need to do about that. But in between is a zone of cells that are functional but not functioning. And if we can get function back, we get function back. Now, I learned that principle from a neurologist who wrote the book called The End of Alzheimer's. And the subtitle of that book is the first program proven to reverse cognitive decline or even dementia. So I tell people, and we've had patients that have been through this, if the brain, or specifically a section of the brain called the hippocampus, is actually about as healthy as that first picture of that foot on the left, you might not remember your kids' names, your spouse's name, your own name. But notice that a few weeks later, okay, you remember a whole lot more. And then finally, when we get to maximum improvement, maybe you only forget a couple of the details of your childhood, but everything else is crystal clear. So with that foot was scheduled to be amputated. Guess what? Never needed it. Total resolution, much better managing of type 1 diabetes. We've had patients on heart transplant lists where ejection fraction, a function of the heart, 11%, 20% is considered where you need a transplant. In a matter of weeks, bring it up to 30%, 40%, get them off the transplant list. We've had people on kidney transplant lists where in a matter of months, we optimize the kidney function. Same thing with liver. So can any tissue of your body respond? I'm going to say, yeah, if the cells are not yet dead, there's always a prayer. And I'll tell my patients, if you have a pulse, you have a prayer. And stress may be one of the top things that we need to intervene on. I taught a series on stress in 2002 with the founder and father of functional medicine named Jeff Bland. And this was probably the most challenging series. And by the way, I've taught over 30 years of seminars to doctors on 6 different continents. But what made stress so challenging is you don't have a single cell or system of your body that's not negatively impacted by negative stress. Over 1 million published medical studies on it. And I might ask the question, does medicine have a non-toxic intervention to reduce your stress? I might even ask, do they have a non-toxic intervention for anything? But fascinatingly enough, you take a deep breath, a really good deep breath, diaphragmatic breath, you actually start changing that process immediately. And there are wonderful nutraceuticals that literally can pull the plug on your body's stress hormone stress response and balance you fairly quick. And it's one of my top interventions. So this was a 2021 study. You can't see the date because my picture's in the bottom corner. But they estimate 75 to up to 90% of all doctor visits are in some way related to some stress-related challenge. And we start looking at head to toe. Name any system that you like, your brain does not work well in a high-stress circumstance. So I'll show a little graphic yesterday, but the 3 organ systems of your body that get the most blood, liver, kidneys, and brain in that order, you start shutting down detoxification, your ability of your body to cleanse itself, your ability to think clearly, your ability to experience joy. All of that is instantly impacted by an acute stressor. Over time, when your body begins to get burned out by stress, you actually can't buffer the inflammatory process. And if you look at the word inflammation, literally means fire within. And we want to have some kind of fire within, but not so much that we burn up and burn out. But that is what far too many people are experiencing. The immune system is compromised. The metabolism is compromised. In fact, I have a very detailed chart. My first degree is electrical engineering, so I like mechanisms. But there's over a dozen proven mechanisms by which stress breaks down lean tissue and increases fat tissue. Also can create bone problems, osteoporosis. I had an osteoporosis conversation with someone this morning. And one, there's a lot of misinformation there. It turns out that bone has more than a dozen minerals, not just calcium. And I ask people, if you had a cake recipe and you wanted to bake a cake, let's say that you found out you needed twice as much cake, you wouldn't double the flour and think you doubled the cake. You need to add everything. But far more dominant in bone is not just the minerals, but the protein matrix. There are over 200 proteins in bone. So when you use a complete bone supplement, like Nutritional Frontiers has, then you can build the protein. You can mineralize ideally, and you can keep your bones healthy. And by the way, I've never seen a petite female over the age of 50 that had a bone scan that wasn't told she at least had osteopenia, if not full-blown osteoporosis. Why? Because they're comparing her to essentially like a 35-year-old elite athlete. Picture a petite 50-year-old female being compared to someone like Serena Williams, in terms of bone density. Doesn't work. It's not a valid comparison. That was one of the things that I said in the intro. when they looked at old fossil records, when they found skulls that had the evidence that the teeth were ground, something called bruxism, which means that you're so stressed in your sleep, you grind your teeth, the person that lived in that skull was accurately estimated to have died about 15.4 years earlier. So think about that. Stress has probably always been the number one killer on the planet. So, very, very busy diagram, but what I want to focus on is what I circled on the left. 3 in 4 people suggest that stress is a big negative on their physical health, and 2 in 3 report that it's a big strain on their mental health. If we go on the right-hand side, that graphic, they talk about something called cortisol resistance, and I'll explain that in a moment. But what that means is your body is not appropriately responding to cortisol. Cortisol is a life-critical hormone, and a big part of what it does is it calms down the inflammatory process. So on the very bottom right, it says prolonged inflammatory response is ultimately the outcome of what people are going to experience. So there's a lot of technical words directly from that citation, and I copy and paste it because I teach doctors all over the world, and they want to know what exactly does the medical literature say. And it says nearly all of us have some level of cortisol resistance. We're not buffering our inflammatory process, and we're also really having a suboptimal response from every tissue, every organ system within our bodies. So unless you can get a hold of that stress cycle, you're fighting a battle you can't win. That actually is the myth of Sisyphus. He was being punished by the gods and he had to push a boulder up a progressively steep hill, and he could never win. Well, if we don't break that stress cycle, people are going to continually be inflamed and nothing's going to work right. So that's a graphic of the brain on stress. Your frontal cortex, that's where you're going to plan and make good decisions, isn't getting the blood. Your joy centers are not getting the blood. What gets it? Reflex action, what they call the reptilian brain, fight or flight. That's the only thing that section of the brain is concerned with. And when we start looking at depression, notice there's a correlation between the amount of stress and the amount of depression people have. And I taught a brain series a few decades ago, and here's what they said. There's universal agreement that 50 to 75% of all depression is stress-induced. So if we don't break that cycle of stress, we have a hard time getting the brain better. When we look at the critical organ systems in our body, it's hard to find a more important system than the liver. You don't live without your liver. And so what they know is that stress damages the liver directly and indirectly, and certainly decreases its ability to ultimately clear toxins. Then when we start looking at actually kidneys, they actually find out that stress will shut down the kidneys as well. So if anybody here is a fan of Chinese medicine, they talk about coupled meridians, coupled energy, things that must work together. Liver and kidneys, they work together, but the adrenals and kidneys work as well. So the adrenals, literally break down the word, ad means at or near, the first part, 2 letters, AD, renal, at or near the kidneys. The adrenals sit on top of the kidneys. And when they become depleted of energy and driving too strong, they'll actually deplete the kidneys. And that could even be to the point of injuring the kidneys. So we just go on the, how did I manage that?
In your pocket.
Oh, well, all right, we'll go right back to that and there. Thank you for keeping me on. Oh, it did it again. I wonder why. Okay. Yeah, my screen is different than what you're seeing there. All right. Well, hopefully that'll come up soon for bigger pictures, but I have that red box around that kidney slide, and the next slide is the graph of blood flow at rest versus blood flow during a fight or flight circumstance. And again, we're all taught that the brain gets more blood than any other organ in the body, but that's only true by unit volume. The liver's bigger, it actually gets more blood. Kidneys collectively are bigger, they get more blood. And those are the big 3 that suffer when the body's in a fight or flight mode. So you're going to shut down detoxification. This was a study from 1996, and I've quoted it for a long, long time. The symptoms of chronic poisoning include fatigue, sleep disturbance, intestinal distress, allergy symptoms, headaches, confusion, and anxiety. And I've said for years, if you got rid of those symptoms, I would have to do something else for a living because that's what everybody is walking in with. Mitochondria, they call that the powerhouse of the cell. They make 94.4% of human energy. We can't live without them, but all the toxins in our environment, and there's over 80,000 registered toxic chemicals, they all inhibit mitochondrial function. And they have now linked all of these toxins to both obesity and diabetes. And we could keep going, and cancer and autism and chronic inflammation and you name it down the line. So they have a term called obesogen. Are there compounds in the environment that generate obesity? They figured it out in 1999, and since then, over 3,600 studies. So I'll have plenty of people that'll say to me, I don't get it. I can't lose weight. I'll tell you what, if we put you on a stress reset and a detox, that usually starts moving you in the right direction. And by the way, these same toxins can trigger an autoimmune thyroid circumstance, everything else. So look at this graph of the rise of environmental chemicals versus the rise in diabetes. And they parallel. So these toxins are disrupting blood sugar regulation, cortisol regulation, and literally all the hormones in our body. So for a science that's only been around for a little over 30 years, this term endocrine disruptors, whether you're talking about thyroid, pituitary, sex steroids, thyroid hormone, they are all potentially impaired by the chemicals within the environment. There was a documentary called The Disappearing Male. There have been less males born around the world in the last 70 years, and there's also a global decline in sperm count. And it's an inverse relationship in this graph according to plastic production. As plastics have increased, sperm production has gone down, and ultimately that can lead to total infertility, not just a lack of males being born. So there's three things I'm going to share here. First is known as the omega SPMs. So is anybody familiar with omega-3 fats? All right, so here's what you're going to know. We need them. They're life critical nutrients. They're essential. Our diet is terrible at them. And I studied under one of the individuals that was right in line for the Nobel Prize with the omega-3 discovery, a PhD researcher named Philip Paul Huxter III. But Dr. Huxter was amazed. After he studied the Inuit Eskimos, he came to realize this was the most robust, healthy, amazing population. And he started taking fish oils every single day. And then the studies started coming out. Omega-3s can prevent heart attack, stroke, and cancer by 13 different mechanisms. Well, around 2000, a researcher from Harvard named Dr. Sirhan said, I want to look at this a little deeper. So he actually started taking radioactive labeled omega-3s and injecting it into rats or rabbits or both. And he would follow them through the body. And what he realized is that the healthiest animals actually converted the omega-3 to a whole new category of molecule that they actually called resolvins. And the reason they called it resolvins is whatever the animal was dealing with resolved faster when they could make these resolvins. Cancer would resolve, depression would resolve, infection would resolve, injury would resolve, endocrine problems would resolve, obesity would resolve. Once he had that data, he said, okay, I wonder if humans do something similar. So he got people to volunteer and he injected radioactive labeled omega-3 into humans. And he found the same thing. The healthiest humans make the most resolvins, the least healthy make the least. Now, it took him 15 years, but the different question that he asked was, well, since these sick people don't do a very good job making resolvins, I wonder if we can actually make them in the lab, because there's an enzyme conversion from the omega-3 to the activated omega-3. Team of Harvard scientists, after 15 years of effort, got it done. They patented the process. He was nominated for a Nobel Prize. And I tell people, if this was a drug discovery, they'd have won hands down, because these are good for literally everything. When I started studying the research, I thought, oh my gosh, everybody needs that. So Nutritional Frontiers has a capsule form And their most recent product is actually a liquid. And it's interesting. I was here yesterday and they said, hey, we want you to try the liquid resolving form, the SPMs, the omega-3s. And I was hesitant because up until yesterday, every single liquid fish oil I tasted was horrible. I don't know if any of you grew up and your parents gave you cod liver oil or something like that. It was never fun. Always tastes horrible. But the one they have tastes amazingly good. And there's people that have a hard time with capsules. So that could actually even be blended into a shake, like the Power Cleanse, and then we add Ganoderma spores to it. Now, what's also fascinating is they're beginning to realize that these poisons are affecting the brains to the point where there's a dumbing down of our population. You might begin to notice that. If you actually pay attention, you begin to realize, what are people thinking? And the more toxins that you're exposed to consistently, the lower your IQ. So it does poison the brain, the body, the emotions, the thought process, the hormones, everything else. When people have cortisol resistance, they're chronically inflamed with a suppressed immune system. So interestingly enough, I talked to a patient this morning, and she was given a series of steroids for something that was going on in her body, and next thing you know, she had an outbreak of shingles. Well, think about that for a moment. The shingles is caused by the chickenpox virus. Most people probably have it when they're, a kid, 3, 4, 5 years old. Well, when you're 73, 4, or 5, why would that virus reactivate? Well, very, very simply, something suppressed the immune system. And those two things are usually stress. Well, let's go 3. Stress, toxins, and inflammatory process, which all work together in a very negative way. And how appropriate or inappropriate, the very first cell that's affected is a cell called the natural killer cell. So these are the cells that kill viral infected cells as well as cancer cells. So I'll take a little viral tangent because, 35 years ago when I was in school, there was a debate about whether or not viruses were considered living entities. And a property of living organisms is replication or procreation. And as I tell people, when a virus wants to have a family, it doesn't find a cute little virus of the opposite sex and say, hey, let's have little viruses. It takes its genetic material, inserts it into your cells, and uses your cells to make the viruses. So if you have cells that are infected by a virus, the natural killer cell should actually kill it. So when we start looking at these new shots where they did genetic modification, go ahead and go to PubMed.gov and you'll realize there's over 300 published studies in just a few years that this has been out of that shot triggering autoimmunity. So it depends on where it goes, but the immune system will attack it. If it's the heart, bad news. Brain, bad news. Thyroid, not as bad. You can medicate that. Other tissues, not as bad, but there are plenty of people that have had some pretty serious consequences from that. So hopefully we learn the lesson of that. By multiple mechanisms, yes, sir. Reoccurring cancer? Well, suppression of the natural killer cells, and there are a number of viruses. So for instance, like the human papillomas virus associated with cervical cancer, hepatitis associated with liver cancer. But you're right. If you actually don't eradicate those infected cells, those are mutated cells, and some of those viruses are more prone to making that cancerous. And the solution is the same. Pick up the immune system. By the way, and I had a patient in one time, or I might even tell a different story. I was doing a phone consult. And at the time, my daughter, who, by the way, is celebrating her 5th anniversary yesterday, has 2 wonderful babies, right? But she was 6 years old. And when I was talking to the person on the phone, we were talking about cancer. And this person thought, oh, my God, this is the worst thing ever. And no one will ever survive, and especially me and everything else. And I looked at him. I said, who has cancer? He says, I do. I said, well, anybody else? He said, well, there's lots of people. I said, how about everybody? The statistics are we all create, and now they say 99.9% of us, but that's almost all of us, right? 500 to 1,000 cancer cells every single day. So I was at a cancer lecture, again, over 3 decades ago. PhD researcher walked into a room of 200 doctors and asked the question, how does a hurricane start? So if I were to ask you, how does a hurricane start? Anybody have an answer to that? There you go. It starts with essentially what he said, when conditions are just right. So the butterfly effect, you begin to realize just a little thing can start a big cascade. Well, after he asked, how does a hurricane start? He asked, how does a tornado start? Same answer, when conditions are just right. How does cancer start? When conditions are just right for cancer. And those conditions are low oxygen, low nutrients, high acid, chronic inflammation, and immune suppression, usually secondary to chronic distress, because those natural killer cells are distressed. Now, here's the magic question he asked after that. How does cancer resolve? And the answer is change the conditions. So on my YouTube channel, I guess it was now about 5 years ago, I was lecturing at a major conference. There was an internationally known oncologist in the audience. And I asked him, okay, of the 350 approved chemotherapeutic drugs, how many of them improve any of the conditions that create cancer? Low oxygen, low nutrients, high acid, chronic inflammation, immune suppression. His answer was none of them. So then all 520 doctors in attendance for the audio, I asked, how many chemotherapeutic agents improve the perfect storm of cancer? None of them. How many of them make it worse? All of them. So you wonder why we're losing the battle. I'm not saying that we don't need big weapons sometimes, but we need to address cause and effect. And that's really the concept behind functional medicine. Now, there's plenty of people out there that are told, your hormones are way off, and especially their sex steroids, and that's what so many people are looking at. But the adrenals take priority over that. There's a section of the brain called the hypothalamus and the pituitary, and they regulate the stress response, the metabolism, the sex steroids. And under a high stress circumstance, metabolism shuts down, sex steroids shut down. So a very clever researcher came up with this very simple quote: you're either making stress hormones or sex hormones, not both simultaneously. Then what it shows, when they can actually measure this level of elevated cortisol and cortisol resistance, it says very, very simply, anti-inflammatory therapy is mandatory because you're not going to get better without it. So we buffer the stress, we detox the body, we modulate the inflammatory process, and our goal is to make everything better. Now, if we look in the middle of that chart, they abbreviated SCI, rather they wrote out the word systemic chronic inflammation. But what you'll see is that is what is the bridge between a bad lifestyle choice and diabetes, heart disease, cancer, depression, autoimmunity, neurodegeneration like Parkinson's and Alzheimer's, sarcopenia, osteopenia, that means muscle loss and bone loss, as well as a shutting down of the immune system. And this is what's really not only disrupting quality of life, but bankrupting the world. We're now approaching something like $40 trillion a year spent on these chronic illnesses where we don't really get after cause and effect. So now we're going to lead into the technicalities of the stress reset. So most people have heard of melatonin, but they think of it as the molecule that puts us to sleep. And it does that. When it's made in the brain by the pineal gland, it actually gets the body ready to sleep. But we're going to find out that the gut actually makes 400 times the melatonin as the brain. Now, you might ask, well, then why in the world am I not asleep all day long? It's very, very simple. Melatonin does not cross the blood-brain barrier. So if it did, we'd all be asleep 24/7. But what happens if you take melatonin and you get tired? Well, there's one or two things going on. You either have a leaky brain, that's not good, we want to fix that, or your body's running on stress hormones, and that means all of your critical processes are running suboptimally. So here, what they found out is that melatonin actually binds to the adrenal glands themselves, and it helps to regulate the stress response. So this medical study says it can be helpful for adrenals that are being burned out, adrenal insufficiency, and I recommend 1 to 2 milligrams every waking hour. And sometimes we do it 7 days, sometimes we do it 10 days. I had a gentleman where we did it for 30 days. And I'll tell that story for just a moment because it's very, very powerful. This gentleman was a lung cancer survivor. And he had a very bad case of COVID. He was in the hospital. He was intubated. And, when he got out, they said, "Oh my gosh, your lungs are so scarred now. You have something called pulmonary fibrosis. You're going to need supplemental oxygen." And he was still pretty young, so like, late 40s. And they said, "Well, and hopefully we get you a lung transplant before you die." So I thought, all right, why don't we start with the stress reset and use different types of enzymes to see if we can dissolve the scar tissue? So they've known for well over 30 years in the medical literature, especially with athletes, if you take enzymes with food, they digest food. If you take it away from food, they get in and they have systemic benefits, including digesting scar tissue. So 30 days, we put them on a stress reset, and I'll show you all the products there: melatonin, theanine, Ganoderma spores, and we used the Nutritional Frontiers enzymes. And it took them 30 days in Canada to get a follow up with a pulmonologist. And the guy looked at me and said, "What are you doing here?" He says, "Well, they tell me I have pulmonary fibrosis." He said, "Well, there's no evidence of that. I don't detect any of that. Go home." So we had dissolved the scar tissue the enzymes had to the point where he didn't have that anymore. And the medical literature uses these words: the application of systemic enzyme therapies appears to be limitless. Those are the kind of therapies that we like to use. So melatonin is part of what we did. When you start looking at melatonin, a lot of people have heard about vitamin D, and they should. It's a very important molecule. It's technically not a vitamin because your body makes it. But vitamin D is made in your body's response to light. Melatonin related to the body's response to dark. All the critical actions as hormones, antioxidants, good for the immune system, anti-inflammatory, you name it. They both have a very big crossover with that. So I'm a big fan of both vitamin D and melatonin. And by the way, they figured out that if you take D, you should probably take K with it. So they have a nice combination of D3, K2, and that optimizes the vitamin D and prevents any type of unusual calcification in your system. This was an article about the hallmarks of cancer, 10 different things that happen as cancer occurs. And melatonin is a positive modulator of all 10 of those. So, no toxicity. In animal studies, and they don't study toxicity in humans, they could actually intravenously infuse 2/3 of the animal's body weight of melatonin in every 24 hours without toxic effects. So it's very unlikely that you're going to ever come anything close to that level of dose. When we start looking at theanine, this is an amino acid in green tea. It's what's called a natural GABA facilitator. It crosses the blood-brain barrier and calms the mind, and has plenty of mental and physical and immunological benefits. So theanine produces relaxation without producing drowsiness. And that's what most people are going for. They don't want to fall asleep all day long. And there are some people, we give them the stress reset and they do want to take a nap all the way around the clock. I tell them, look, you're either running way too strong on those stress hormones or you have a leaky brain, but this protocol should actually resolve both of those issues. Little technical issue there. So theanine does increase GABA, 100 to 200 milligrams every waking hour. Then finally, we go to Ganoderma, also known as reishi, the consensus top superfood on the planet. Its implications in stress, over 277 citations. And it took them till 2022 to realize that it actually reduces the amount of circulating stress hormone in your bloodstream. So it is very, very good at releasing the stress hormones and therefore optimizing the body's response. It's also known as an antidepressant and an anti-anxiety. They call it the herb of spiritual potency. If you lower the stress and nourish everything else, that would be a pretty good way to get in touch with your best self. Hundreds of studies on its brain benefits and the major neurotransmitters, serotonin, dopamine, acetylcholine, and GABA, all benefit serotonin happiness. Dopamine depends on where in the brain. It could be focus, it could be fine motor control like Parkinson's, or it could be intense joy. And then acetylcholine, memory, GABA, calming. But notice it says it's Alzheimer's prevention, anti-seizure, and even induces neural stem cells, meaning you can grow healthy new brain tissue in response to this. So with this, we use 200 to 500 milligrams every waking hour. And by the way, the form of Ganoderma that we use is the Ganoderma spores, because some of the components there are 75 times more concentrated than in what's called the flowering body, the Ganoderma lucidum. And I've taught people for years, bodies respond to frequency, duration, intensity, quality, and timing of stimuli. One of the huge differences between drugs and nutrients is how long they last in the body. You get a drug, you might take one a day. Well, what does that mean? It means it takes a full day for your body to even clear a significant portion of that. If you took it more often than that, you'd get intoxicated by it. But nutrients clear the body very, very quickly. And that's good. That means there's no toxicity or very low toxicity to them. But that also means if you want to benefit optimally from them, you need to take frequent dosing. So I like the Calm Day every waking hour, the melatonin every waking hour, and there are the Ganoderma spores that I also recommend every waking hour. Beautiful sleep remedies, got a lot of great things in it. 5-HTP, that's 5-hydroxytryptophan, is a precursor of serotonin. Theanine produces the GABA, has directly in melatonin and other factors that help to keep the brain calm and put people into a deep sleep. We also have a Ganoderma infused coffee, and you can sample some of that here, coffee and teas. And here's what I tell people, when you start looking at the world champion athletes that I've treated, these were all very, very, very disciplined individuals. When they were, training for a championship or, their season or whatever, they were diligent about everything they did. And that included their supplements. But when their career ended, most of them slipped back on that pretty significantly. So when we infuse the top superfood in the planet in coffee and tea, most people drink coffee and tea. They drink it every day. They never need to be reminded. They never plan to quit. So it's just changing what could be a toxic, acidic habit into something that's healthy and alkalizing and anti-inflammatory and literally good for the body, mind, and spirit. This was an interesting study. This was published in March of 2020. You look at the date, March 15, 2020. This was out of China, and they compared people that had COVID that were hospitalized. And they said, what happened if we gave them just Western medicine or drugs, as opposed to giving them Western medicine plus traditional Chinese medicine, herbs, of which the top herb happens to be reishi, also known as Ganoderma lucidum. The survival benefit was more than 27x those that got natural therapies along with pharmacologic therapies. So how fascinating. If we knew this by March of 2020, shouldn't that have been the protocol for everybody? And the sad reality is that information was sadly suppressed. So we might have to look into that and figure out, why would that be? Interestingly enough, when you buy organo products, and Nutritional Frontiers World of Wellness has partnered with this. I'm an investor in the company because I think everybody needs to make better choices. They have a little barcode on the side of it, and you scan it and you find out where was everything sourced, what type of testing did it go through. It's tested for herbicides, insecticides, fungicides, mycotoxins, and we have absolutely the cleanest, purest coffee and reishi on the market, and we back it up. You can scan every single box and figure out, okay, how good is this? And anybody ever listen to Zig Ziglar? Anybody know who he is? I love Zig. And, he struggled his first years in teaching and speaking. And he said, what was the big change in my speaking was I told people what they needed to hear in a way they wanted to hear it. So he became a master storyteller. And I've got to tell you, that was a quantum leap in my clinical practice as well, getting people the nutrients they needed in a way they wanted to get it. So if you haven't tried one of their shakes back there, give it a shot. You're going to find out that this is beyond delicious. You'd have to take many, many handfuls of pills to equal what they give you in a shake, but you absolutely enjoy the shake. High quality proteins, enzymes, vitamins, minerals, different types of botanicals, all in there. Kids even like it. And then we have coffee and tea infused with the top superfood, and even hot cocoa for kids. And I went and happened to grab some of the reds. You look at their drink blends, all these wonderful plant nutrients. They're delicious, they're easy, they go down good. They nourish the body, mind, and spirit. And when we look at what's going on in the world, big companies and big pharma are buying up nutrition companies, supplement companies. Now, I might ask, why do you think they're doing that? Well, think about this. What do you think is more profitable? Vitamin C or whatever drug they're selling? Some of those drugs have 1,000x markup. Vitamin C may be 40%. Now, interestingly enough, if people are taking supplements, are they likely to take drugs, or more likely or less likely to take drugs? What would you guess? Less likely. So this has been going on around the world for decades. They put upper limits of nutrients on all the nutraceuticals in Europe. They made things where you couldn't sell them anymore. They said, no, there's too much nutrition in there. You got to calm it down. Was the biggest problem in the world people getting too much nutrition? Or how about not enough? So what we're finding is that when these big companies buy it up, well, they say, well, we can save money here by using a less effective ingredient. We can save money here by doing this. We can save money by doing that. And every time they save money, they take away something that actually made that product more valuable. And instead of making it valuable to the human, they make it profitable to the corporation. But where does the ultimate profit come from? If you're a drug company, it comes from your drugs. 1,000x markup versus a 40% markup, no comparison. So just food for thought there, and that's one of the things that I love about Nutritional Frontiers is they're committed. They are not going to play that game. Committed to good quality, good products, keeping everybody healthier. So I had a question about heart rate variability when we started in stress. Anybody know what heart rate variability is? It's basically you should have a variation in the beats between the heartbeats. Simple enough. There should be a variation. Now, one of the people that I treated, a very famous patient, was Evander Holyfield. And he had a heavyweight fight maybe 25 years ago. And in that fight, he threw more punches than any heavyweight ever had done before. They said, my gosh, how could you be so fit? So they wanted to study him. So they sent him to the Mayo Clinic for a bunch of heart tests. And you know what they told him? They said, you've got some crazy heart defect. You may need to retire. Well, here was the deal. They'd never seen an EKG like he had before. Anybody know what EKG is, electrical activity? You know what the easiest EKG is? Flatline. You know what the most healthy EKG is? The most dynamic. It's all over the place. And that's what his was. They'd never seen anything like that. And they said, there must be something wrong with you. Now, there must be something right with you. Look at what you just did. But when you're different, people don't know how to handle that, do they? So heart rate variability, and I have an Oura ring on here. And you know what? This is easy. It monitors my steps, my readiness, my sleep. And in my sleep, it measures heart rate variability. And so what you'll notice, if you're on vacation, and we want to create lives where we almost get like a little vacation every day, right? I have a friend that lived in Hawaii. He says, I take a 2-hour vacation every day. He gets out on a paddleboard and just, how awesome is that? Shouldn't we have our own little sanctuary that way? But on, weeks where I'm really working hard, and there's plenty of those, I can see that my heart rate variability declines. And when I'm on vacation, my heart rate variability rises. So stress, reset, if you do that and you monitor it, you're probably going to find out that there will be a significant improvement in heart rate variability. Any other questions about anything at all? Jamie's got shakes over there. By the way, if you have not tried that shake, it is beyond amazing. You're going to get, yeah. Now, what's interesting, if you had a picky eater here and you said, wait a minute, you got greens in there, I'm not eating it. But, okay. Well, and you'll probably drink it and enjoy every sip. Yeah, isn't that amazing? So who knew that the healthiest thing that you could put in your body would taste like dessert? So that's a beautiful advancement. When I teach nutrition, we like to come up with these little phrases. Rakowski's first law, and I came up with this over 30 years ago: healthy bodies don't get sick. And people think about that for a moment. They go, wait a minute, is that accurate? Come on, healthy people get sick. No, when they're sick, by definition, they're not healthy, right? So healthy bodies don't get sick. You heard me talk about mitochondria. That makes 94.4% of human energy. I tell people, you take care of your mitochondria will take care of you. So Nutritional Frontiers has something called Power Fuel, and it enhances the efficiency of the mitochondria. So my rule on greens is the rule in nutrition is the same as the rule in finance. Greens are good, and you can't get too much. So keep enjoying those greens. Beautiful. Any other questions about anything at all? Well, so when we start looking at trigeminal neuralgia, Mark Hyman, who's a good functional medicine doctor, New York Times bestselling author, was one of my students in the 1990s, now runs the alternative medicine program at the Cleveland Clinic. But he says medicine's guilty of something called the name it, blame it, and tame it syndrome. So they name the condition, they blame the problem on it, and they try to tame it with a drug. So the trigeminal nerve is a very important facial nerve. Neuralgia means the nerve is algia, having pain. So what does that tell you? Nothing. You walked in and said, my face hurts right here. Well, that's the trigeminal nerve. You have trigeminal neuralgia, or then they have a fancy term for it called tic douloureux. So here's the question: what caused it? Now, interestingly enough, sometimes it happens after a head or face trauma. Could even happen after dental work, which could be a trauma. And so there's a lot of things that I do different and more complete than a lot of practitioners. And one of those things is cranial manipulation. So you can actually move the skull and maybe free up that foramen and take some of the mechanical pressure off that nerve. If someone needs a stress reset, and if my face hurt all day long, I think I'd be stressed. You do that stress reset, you actually get the cortisol having an anti-inflammatory process. Well, then maybe you calm down the inflammatory component that is definitely there. We talked about toxins, over 80,000 registered toxic chemicals in the environment. We talked about the endocrine disrupting potential, the obesity component. But when I showed you that picture of chronic disease, toxins are a trigger, can be a trigger of all chronic disease. So if we were to do a stress detox, stress reset, good detox, good structural correction, we may get ahead of that. So you look pretty healthy. Is it you or someone else? It's you. How long have you been dealing with that? Oh, that's way too long. How did it start? Any trauma or dental work or infection or? Okay. Well, if you didn't have a physical trauma, then it's something happens on the inside. So, but here's another one of Rakowski's laws. In the absence of trauma, bodies break down on the inside before they break down on the outside. So something triggered that. And is it reasonable to do a stress reset? Always. It's certainly first do no harm. Is it reasonable to detox? Again, it's a first do no harm strategy. So imagine if you just added what you just had to your daily protocol and that went away. Wouldn't that be fun? Yeah. So I'm going to suggest you do that. When I have people do a detox, they do 3+ shakes of those a day, only organic, non-starchy vegetables, because those are good at alkalizing, bringing in the right fiber. All good vegetables are nice prebiotics to the healthy bugs in our gut. We have more bugs in our gut than we have cells in our body. The difference between good bugs and bad is what they eat and what they poop. Good bugs eat poop and poop nutrients. Bad bugs eat nutrients, poop toxins. In this part of the world, we have horrible gut bug environment. It's almost what I would call Western or universal dysbiosis. You look at Africa where they eat a natural diet and they don't have appendicitis and they don't have chronic digestive challenges. And it's very, very fascinating that they live off the land and they don't use the herbicides, insecticides, fungicides. There's a wonderful medical researcher turned natural medicine. His name is Zach Bush. And he talked about using the herbicides, insecticides, fungicides. He says, look, if you kill everything around you, you're going to die. It's just that simple. But I never heard it put that way before. But what are they doing? They're killing everything around us. And what are we doing? We're dying slow deaths, like death of 1,000 cuts. Every time you put some of that stuff in your body, you're poisoning yourself. So go all natural, get the good supplementation, get your body to come around. Hmm. Well, so eosinophils are elevated in response to allergy or parasite, and it shouldn't be over 3%. So I mentioned the guy that just missed winning a Nobel Prize, Philip Paul Huxter III. And he made the statement, he says, when it comes to toxins and parasites, it's not us against them, it's us with them. So parasites only attack weak tissue. At some point, some tissue got weak, it likely got infected. If you had allergy, you'd probably know it, right? So these strong parasite cleanses could be very, very helpful. And the problem with drugs is they're so specific. Now, if you had a parasite that responded to a certain drug and they could identify it, well, that would be helpful. But that's almost never the case. So you do a good natural parasite cleanse over time. Well, check with them about their anti-parasite products, and I would buffer it with a stress detox, stress reset, and a detox as well. Yeah. Other questions about anything at all? Did that answer yours? Likely as a parasite. Yeah. If you seek, you'll find. Yeah. Especially when there's labs that are off. If a doctor orders a test and doesn't understand the results, okay, time to find a new doctor. Someone that's got a little different approach. Well, so keep in mind. Wow. Well, so keep in mind, right? They actually found that ivermectin, which is like an anti-parasitic, one tremendous benefit against COVID. But if it actually works against COVID, is it, and therefore, would your body have parasite type markers after that shot? Well, not everybody, but some, and you are one of those, right? So, interestingly enough, I could go to PubMed.gov and say, type in COVID-19 vaccine and elevated eosinophils, and we could see what we find. Yeah. Well, there you go. You're not alone in that. There's over 300 studies just on autoimmunity being triggered by that shot. Yep. Yeah. It was probably a B vitamin deficiency. Yeah. Yep. Yeah. Did that help? Okay. A lot of times that's a disaster. They stop doing that. But so what's interesting is we our stomach is meant to actually buffer ourselves against hydrochloric acid. Our esophagus is not. So there's a muscle. It's called the lower esophageal sphincter, and tone of that is maintained by stomach acid. Now they've known that since 1969 in the peer-reviewed medical literature. So if stomach acid maintains the lower esophageal sphincter tone, what happens when you shut down the stomach acid? You shut down the tone and you get acid reflux. So people don't tend to take acid blockers for a week, which is how they originally studied, there was a good reason to block acid. If people had a gastric ulcer, they give them an acid blocker for a week, let it heal. But most people that take acid blockers take them for more than 20 years because they suddenly can't do without them because the body has a rebound effect when you stop it. So they have to be weaned from, interestingly enough, which is same with a lot of medications. You're welcome. Let's get you better. Any other questions about anything at all? Yeah, tinnitus. That can be challenging. Uh, well, there you go. Try the stress reset. So, stress related tinnitus is easier to manage than, for instance, damage, right? My wife regrets having gone to a very loud concert at age 12 and damaged her ears and has had ringing ever since, or buzzing more so. So, yeah. No, I agree. Yeah, if you're going to be, that could have lasting semi-permanent damage, right? So, okay. Yep. Okay. Yeah. Well, the first thing we have to figure out is what's causing the problem. Well, an EMG can figure that out. That's typically the site of the pinch for drop foot. And so if it's at the spine, you want to correct that. Could it be at the pelvis? You want to correct that. Sometimes there can be a peripheral entrapment, but they ought to be able to find out precisely the origin and then target the therapy towards it. So, did they ever do a needle EMG and say, here's where your block is? Well, that's the question. So, well, I always tell people, well, nerve conduction study. I always tell people the first question we have to answer is what's causing the problem, right? So, our wonderful friend that asked about trigeminal neuralgia, well, that's not what's causing it. That's what you call it. Drop foot, that's not what's causing it. That's what you call it. Tinnitus, that's not what's causing it. That's what you call it. But if you start looking at what I call the deadly quartet, and I'll share this because I didn't come up with that term. There was an article published in the Archives of Internal Medicine, 1989, and they said if you had a big belly, high blood fat, high blood pressure, and high blood sugar, you were going to die early. So they were calling that the deadly quartet. All of those are effects of the combination of stress, toxins, malnutrition, and physical inactivity. So if we're going to address it, that's where we go to work. We buffer the stress, we clear the toxins, we nourish the body, and we get people moving appropriately for them. And I was talking to, again, someone this morning, and they said, I figured I needed to get moving, so I did this, but then I ended up in bed for 3 days. Okay. Confucius said way back when, to go beyond may be worse than to fall short. You could stretch, stretch, stretch. You go too far, you snap. You don't want to do that. You overtrain, and then you put your body in a greater deficit than before you started. So you don't want to go beyond. You want to do just the right amount. We call that the Goldilocks rule. Not too hot, not too cold, just right. Any other questions about anything at all? Yes. You get intermittent weakness in same side legs, same side arm, both legs? Okay. How long does it last? How often do you get it? What makes it go away? Any common triggers? Okay, but it does go away. Okay. Well, as the day goes on, stress likely increases. So why not try that stress reset? So again, what we do universally, first do no harm. Uh, it's so fascinating that I'll have people come in with these very obscure symptoms, and doctors go, "Well, we don't know what to do." Well, then let's follow the first rule: first, do no harm. You know, and so if you said it was stress related, what would they do? They might give you an anti-anxiety drug. They might give you an anti-inflammatory. They might give you something like gabapentin. I mean, they just write a prescription and let's hope you feel better while the body heals. Well, hey, I'm okay with symptomatic relief, but never at the expense of actually figuring out what's causing the problem and solving it. So, since it might be stress related, give that stress reset a shot. They've got everything here you need to do it. Could be one of the best things you ever did. Oh yeah. Well, I would do the calm day, the melatonin, the spores, and the SPMs. Now, keep in mind, SPMs I recommend for everybody. There's not a single person that doesn't need omega threes, and there's a point in life, and it might for some people happen after the age of 20. I'll often ask people, when they come in, when's the last time you felt good? And they might say, well, junior high school. It's like, okay, you must be doing a lot of things wrong, you know? And then I have people in their 80s who, for them, 80's the new 50. I met a guy here yesterday, 80's the new 50. That's what we want. Can we all get there? I think to some degree we can start approaching that. But SPMs will be a good step in that direction. You're welcome. Yeah. Well, it'll intoxicate you in the process, So, well, what again, the term is called functional medicine, and that's actually addressing cause and effect. Ha, yeah, that's a good start, right? But when I was listening to that, audio yesterday, you look at functional medicine, Dr. David Perlmutter, he's a best-selling New York Times author and he's the only guy at the time that was board certified in both neurology and nutrition. And he became that because his father, who was a brilliant neurologist, I think had severe Parkinson's. He said, how did his brain fall apart? And he realized, even though he had the medical stuff down, he didn't do anything in terms of the natural medicine. So he said, I don't want that to happen to me or my patients. But the way that Dr. Perlmutter described functional medicine, he described it as the opposite of dysfunctional medicine. And then someone said, okay, what's dysfunctional medicine? He says, that's where instead of addressing cause and effect, you keep experimenting with drugs, hoping the patient will feel better, and how many practitioners do that? Here's my answer. Way too many. Way too many. So, and the answer might be why? Well, listen, they're educated to do that. It's a whole new world of information when you start studying natural medicine. You can study it for your entire life and you barely dent it. Whereas how easy is this? What's your symptom? What's the drug? Here you go. I mean, AI can do that. Other questions about anything, which, by the way, when you say you need a new doctor, that's what World of Wellness is about. A bunch of different specialists with whole different technologies and always non-toxic interventions that can really unwind complex circumstances fast. So I'll share, I had a guy come in to me, he was my patient of the year 5 years ago. And I have different categories of patient of the year, but this guy comes in and he's basically like a year younger than me. And he's recovering from prostate cancer surgery, and I'm like, how the heck did that happen? He says, I don't understand. I've got a really great medical doctor. I said, well, tell me about your doctor. He says, well, yeah, I've had him for 30 years and, he's helped me with everything. And he diagnosed that and, got me with the right surgeon and hopefully I get my sexual function back and all this else. I said, well, let me ask you a question. You've had this doctor for 30 years. He says, yeah. I says, how many drugs were you taking 30 years ago? He said, none. How much overweight were you 30 years ago? He says, I was in great shape. Okay, so under his care for 30 years, you become diabetic, hypertensive, obese, and have had prostate cancer? I said, how do you call that a great doctor? I would have given you a kick in the pants Hey, Bob, what are you doing wrong? You're 5 pounds fatter. Let's not let it get to 100 pounds fatter. Let's address it now. So, um, you know, they certainly have their place and they have their specialty. And if you were in crisis, you might need what they're offering. But if you want to get healthier, it's probably not the place to go. Yeah. Well, there's a couple different camps. Now, my parents are, I don't want to say they're anti-medicine because I have a sister who's a nurse practitioner, another ER nurse. But my grandmother, my father's mother, had such severe dementia for the last decade of her life. But all she ever did was go to doctor visits, doctor visits, doctor visits, one drug, next drug, next drug, next drug, next drug. She was drugged out of her mind, literally. Yeah. And so there's a different way. So the blue zones, this is very fascinating. If you haven't heard of that story or looked at the books, it was a study. Areas of the world where they consistently live to be over 100 and healthy and fit, and you look at their protocol, it has nothing to do with drugs. It has everything to do with healthy choices. Absolutely. You know, they all had good family, social support, a mostly organic diet, a physically active lifestyle, and they had a purpose. Yeah. Oh, you know what? So I was at the TED Talk. I was front row. It was a black tie event when Dan Buettner was presenting. And this was fun because it was a big fundraiser, and I'm sitting around this table with all these mega influencers. I got invited because I was teaching a health seminar in town, and they said, "Oh my God, we want to bring you to this." So I go there, and they asked me, "Well, Dr. Bob, what do you think?" I said, "Well, let me ask you a question. First and foremost, how long ago were these people born?" So play with me. How long ago were the people in the blue zones born that they're studying? They're all over 100, so they're born 100 years ago. And then I asked the question, how much of their diet was organic back then? All of it. How many herbicides, insecticides, fungicides were they, being exposed to? How many neurotoxins were they injected with moments after birth? How many of them used the TV clicker and the garage door opener? None of them. And so I asked the question, are we comparing apples to apples? That doesn't mean we can't learn from it. But the more we learn, you realize that modernization is the enemy of health and the friend of the drug companies. Now, I like modern conveniences, but we've depleted the soil. We've intoxicated the environment, and even the artificial light creates a constant stress response in our system. So as we get as natural as possible, we get better. No, no, you're yeah. Yeah. Oh, no. Well, that's a fact. Well, now let's even take it a step further because all the pharmaceuticals are found in that water too. So there was an interesting study. If you go to PubMed and you typed in birth control pill and prostate cancer, here's what you're going to be shocked. In areas of the world where women take the most birth control pills, men get the most prostate cancer. So what's going on is they have such a powerful estrogen in the birth control called ethinyl estradiol, 100 times stronger than human estrogen. These women pee it out. It gets in the groundwater. It doesn't get filtered out. And if you drink that and you're a male, you're getting that strong estrogen. It's going to be the enemy of the prostate, the enemy of testosterone, promoter of autoimmunity, all this garbage. And, we've just got to stop. We've got to stop poisoning our environment and everybody in it. Other questions? I literally could talk for hours, and the most I ever talked was like 12 straight days. I was teaching a seminar in Sweden, was scheduled for 12 days, 8 hours a day, and I don't run out of material. So, yeah. I do. Dr. underscore Bob underscore Rakowski. Now, what's fascinating, I had so many strikes against my channel, I've probably been shadow banned. I did 100 days of COVID updates. And then I finally got a call and they said, Bob, you're actually putting your wellness and your family's wellness, if not only your in your economic wellness, by speaking out against this. I suggest you shut up. It's like, holy cow. Because I started promoting, okay, this has got a 1% fatality rate. Average age of death is 82 with multiple comorbidities. What do we have to worry about? Not much. Get healthy. Yes. Well, so your heart has its own electrical system, and it needs minerals and it needs insulation, it needs balance. And so heart palpitations are not normal. They can produce a clotting risk. So there's an abnormal conduction. Thyroid dysfunction can be a part of that. Autoimmune thyroid, which, by the way, if you don't screen thyroid antibodies when testing thyroid, you're missing it. It's one of the primary causes of palpitation. But there's a process the body does a billion, that's what it be, a billion times every second, called methylation. And when you methylate appropriately, you actually convert methionine and ultimately cysteine down to something called taurine. And taurine is a powerful membrane stabilizer of the heart. So you could take 5 grams of taurine 3-4 times a day, and sometimes that in and of itself will stabilize that heart membrane. But you also need magnesium, you need acid alkaline balance, you need the stress reset, you need the omega-3s and preferably the resolvin or SPM form of omega-3s. But generally speaking, that level, most arrhythmia we resolve in 7 to 10 days with the right protocol. Sure. Yeah. So what's interesting is the gut also has its own independent nervous system. They call it the enteric nervous system, and that is even more dynamic and vulnerable than even the cardiac conduction system. And I always tell people if there's a gut issue, we want to answer 5 questions. And keep in mind, I have patients that are gastroenterologists. They'll come to me and they'll say, even in my specialty, they didn't teach this in medical school. And here's what I tell people. Here's the 5 things you need to know. Number 1, what are you eating? Do you think they address that at all? No, they're not even trained in it. Number 2, how's your digestion? And now we start looking at stress and its impacts, and you need hydrochloric acid, you need good kidney function, you need good digestive enzymes within the small intestine. Next, what kind of bugs live in your gut? Now, how many people do you think have a bad balance of bugs in their gut in this part of the world? It's almost universal. Next, how often do you poop? And you should eat something, and literally whatever is the remnant of that should pass out in 18 to 22 hours. There's actually something called the gastric colic reflex. And how fun that I have 4 granddaughters, but and they're all beautifully nursed and wonderful moms. They eat, they poop. They eat, they poop. They eat, they poop. Fill up the top, empty the bottom, make room for more. That's how we were designed, and yet we get away from it. And then the last question is, do you have a leaky gut? And way too many people that are unhealthy have a leaky gut. When we address those 5 issues, and again, Nutritional Frontiers, go look at their gut protocol. They'll enhance your digestion. They'll seal and heal the gut. They'll give recommendations on a reasonable elimination diet with the right types of enzymes or sometimes even hydrochloric acid. And I like about a good 10 days on the gut. And most guts, we can solve serious issues like that in about 10 days. Yeah. Well, it's in his best interest not to answer it. Why do you think they were given total indemnity before they got on the experiment? And what's interesting is India didn't give them an indemnity. So they didn't vaccinate India. It was one of the first places in the world that large scale cultures, they completely eradicated COVID. They've got regions where there's, hundreds of thousands, hundreds of millions of people, sorry, and they eradicated COVID with vitamin D, zinc, and ivermectin, which they gave to everybody. Powerful stuff. Yeah, of course. Well, keep in mind, when they finally forced Pfizer to release the data, they found out they only studied it on 8 rats. And it had almost no benefit. It didn't stop infection. It didn't stop transmission. So the lies that were told were just lies. 75 years. That was Pfizer. 75 years. Yeah, we'll release it 75 years after everybody's dead. Now, there's a guy, if you like YouTube, there's a guy named Ed Dowd. And he wrote a book called Died Suddenly. He was a Wall Street guy. And so he studies financial markets. And he looked at the end of 2021. He realized, holy cow, the funeral industry had record profits and the life insurance industry lost money. And what they found out is the death in people 25 to 44 went up 13 standard deviations. Now, in statistical analysis, if it goes up 3 standard deviations, that's a once in a 100-year event. 13 standard deviations, something sinister was going on. So, good news, you're still here. That means, in my mind, God still has a plan for you. So, let's get you better. Yeah. Well, I think that happened to Jamie Foxx, too. I don't know if he's back. He needed to get a shot to be on a movie set, and he hasn't been back since. I think he went blind and paralyzed. Yeah. Well, isn't that shocking that none of this information is easily accessible? So, when this first came out, they were talking about the swine flu, and they had 25 adverse reactions with that shot, and they pulled it. I wouldn't doubt that they had 25 adverse reactions in the first 10 minutes of giving this one. But, they had they were totally indemnified and keep moving forward. Other questions? We wrapping it up?
Do you want to take a break for like 30 minutes and we can get back on with Jamie for a little organo coffee discussion?
Sure. Absolutely. So we're going to take a break and then we're going to come back and we're going to have a nice conversation.
Yeah. Perfect. Great. Thank you.